intertrochanteric fracture that is already happened. And now I am going to present my talk on replacement in intertrochanteric fracture, a novel option. So all of you know that the elderly patients with the IT fractures are vulnerable to comorbid conditions that risk life even if operated. So for early mobilization and weight bearing, joint replacement for IT fracture is one of the treatment modality. So selection criteria. So previously we are discussing about it. The age 65 and above for failed IT fractures, fixation, and the age 80 and above for primary fracture, which belongs to unstable IT type, that is AO31, A2, 2.1, 2.2 and 2.3, and patient must having the comorbid conditions. So what are the implants for this intertrochanteric fracture fixations? There are calcar replacement devices, metaphyseal or diphyseal engaging stems that may be cemented or uncemented type. So what should be the approach? The most common approach used by me was the KL approach for failed intertrochanteric fixation fracture and the transtrochanteric approach for the primary fracture fixations. So there are some basic steps for replacement in IT fractures, where the basal osteotomy at the neck of the fractured femur in failed IT fixation and the transtrochanteric removal of the head and fractured neck and the creation of calcar by the neck portion. So all through the posterior dislocations, we reconstruct the GT or LT either by the SS wiring or K-wire fixations along with the ethibone suturing. So this is the most common approach for the primary fracture fixation in IT fractures. We have to take care of the piriformis, that is the one of the strongest hip stabilizer. We have to look for the limb length equalization during the operation, and we have to also take care of the versions. In IT fracture, we must took the version 5 to 10 degree extra to prevent the dislocation and try to use the high offset stem, that is the recommendation. So what is the importance of reconstruction of the GT? It provides us the stability, muscle functions, pain relief, mobility and function of the hip joint, and prevents the complications, even if the dislocation. So this was my first case in which there is DHS done 6 months earlier and the DHS was failed. So we opted for the total hip replacement because there was acetabular damage, and long stem was opted because of the peri-implant fracture considering the screw of the implant DHS. And this was the 6 months and 3 months post-op. This is the patient walking independently. This was the second case of the failed PFN, in which we opted for the cemented long stem modular bipolar. And the patient sent the video from his village. He is walking independently by leaving the walkers. So he has bilateral varus knee, even if he is walking independently. This was my first case. This is the type AO type 3, 2, where this neck fracture, combination, lesser trochanteric, greater trochanteric fracture, we opted for the primary modular bipolar replacement, cemented type, and allow patient immediate post-weight bearing at the age of 81 years, patient walking full weight bearing with the help of walker. This is the interesting case of 90 years old ladies with the combination of the head and neck. We opted for the cemented modular bipolar GT reconstruction was done with the Ethibone and SS wiring. And at the age of 91 years, patient is walking independently with the help of a stick. So in my opinion, this IT fracture, the replacement is one of the options. And the rehab program was started immediately with the help of physiotherapist. We allow post-op walking after the second post-op day. And in conclusion, I want to say that the replacement surgery for unstable IT fracture is one of the best modality in comorbid patients. And replacement is the salvage procedure for the failed primary surgery for IT fractures in elderly, and it is also one of the treatment modality for delayed presentation or non-union IT fractures in elderly. Thank you.
Thank you, Prakash.
Any questions, please?
It is very good method. We have used long stem by modular bipolar in many cases, and found good results. Thank you for presenting good
Thank you, sir.
paper.
I thank the chair.